To many people's shock, Ireland has narrowly avoided a second level 5 lockdown. But what have the government been doing or not doing for the last 7 months to avoid such a requirement? This is Ben Scallan and you're watching Gript Media. Well, the government has defied everyone's expectations and for once have ignored NPHET's advice, choosing not to shut down the country for 4 weeks despite what was recommended. Instead, the government have opted to compromise and put the country under level 3 restrictions. Now, this is obviously still serious and will have big implications for the economy, but it is the first time the government has not followed the strict advice of NPHET. However, predictably, there are some medical advisors who are not at all happy about this. For example, Dr. Tony Holohan, who has just returned to his position as Chief Medical Officer, has warned that level 5 lockdown is the only opportunity we have to contain the virus. Now, if we cast our minds back, this is a big departure from Holohan's previous position on the subject. Back in March, the man went to great lengths to insist that a lockdown was completely unnecessary. For example, recall this article from the Belfast Telegraph in March of this year. Health Chief insists Republic will not enter lockdown as new cases confirmed. Ireland's Chief Medical Officer, Dr. Tony Holohan, has said he wanted to dispel rumours circulating on social media that the country would lock down. At Friday evening's media briefing on COVID-19, Dr. Tony Holohan responded to rumours that the country would be put under a status red lockdown in the coming days. He said, "I have heard those rumours from my own family and on the street and they are not true. This is not a part of our plan. We are not locking down the country. We have no plans to lock down the country." The measures introduced today have obviously created challenges for normal family life and for community life and people's working lives, but it is not a lockdown situation. I want to repeat emphatically, we are not locking down the country. We have heard rumours about soldiers and Gardaí on the streets and so on, but we have no plan to do anything like that. Well, of all the statements that didn't age well through Irish history, I think we can safely put that one into the Hall of Fame, up there with Michael Collins' "They'll never shoot me in my own county." Now, to be fair to Tony, a lot has happened since March and nobody had a crystal ball back then to know what would or wouldn't be necessary in the coming weeks and months. So we'll give him the benefit of the doubt on this one, but still in all, dramatic U-turns on important issues like that do call a person's judgment into question whether they're an expert or not. So when we hear things like, "we need a lockdown urgently to stop the health service being overwhelmed," I don't know about you, but I start to get a weird sense of deja vu, almost like we've been here before. Wasn't this almost exactly what we were told about the first lockdown months ago? To quote Dr. Ronan Glynn, the HSE's Chief Medical Officer back in March, "If we do nothing, the number of cases will increase rapidly and challenge our healthcare services. We need to flatten the curve, to slow transmission, to reduce the total number of cases and spread the number of cases out over a longer period of time." Holohan too went to great lengths to emphasise flattening the curve, posting graphs with an aim to slow the spread of the disease and reduce the burden on hospitals. We had horror stories from Italy and doomsday predictions of having to triage the sick and the old. We were given visions of infected people being turned away at the hospital and left to die because there wasn't enough capacity for them. And that's why we were told that the lockdown was needed. But what was the outcome of that lockdown? Well, it was financially agonising for jobs and businesses across the country, that's the first thing. But we were told that it was necessary to buy time for the health service. They needed breathing room, if you'll pardon the pun, to acquire more PPE, more equipment, new treatments for the virus, work on a vaccine, and so on. Bear in mind, the disease was always going to spread through the population. That was never in question. Our job as the general public was to hold it back just long enough for the government and the health service to handle it long term. But it's now been 7 months since that process began. The curve is long flattened, the crisis is behind us. And where exactly are the results from all that effort? Apparently, they're nowhere to be found, and we have no reason to assume that that will change with a second lockdown if we have the same politicians at the helm. Take ICU beds as an example. In 2009, 11 years ago, way before COVID, the HSE said Ireland needed 579 ICU beds by 2020. At the start of the virus, we had a mere 225, and since then we've gained 55. After the winter plan, the government is expecting 17 more, bringing us up to a total of 297. So in other words, things are moving at a snail's pace. You'd think increasing our hospital and ICU capacity long term will be the number one priority. What have they been doing this whole time other than attending golf dinners in Clifton? Well, that and of course the 6-week summer holiday they took in July. As numbers steadily increase, they'll tell us that they aren't ready for a surge and that they desperately need to take drastic lockdown measures that further crash the economy. In fact, Professor Sam McConkey, who leads the Department of International Health at the RCSI, went even further, hinting at the idea of levels 6 to 10 on top of the original 5 tiers, including mandatory curfews at 10 p.m. every night. In his view, not only might level 5 be on the cards in the foreseeable future, but we could soon be dealing with even more strict levels beyond anything we've seen so far. Although, bear in mind that this is the same man who said back in July that we should aim for COVID-0. This is a goal that most experts would say is ludicrous. The World Health Organization has said that even with a vaccine, we'll probably have COVID for the foreseeable future. We've had a regular flu vaccine for years, and guess what? Hundreds of thousands of people still get the flu annually. So the idea that we're going to completely eliminate COVID is preposterous. But still, this gives you an indication of how our leaders and our health authorities are thinking about these issues. It's starting to feel like things may never go back to normal if these trends continue, and that's not good for our health, our economy, or our well-being. Please like and share this video, and if you enjoyed it, please consider signing up for a monthly donation via the link on screen to help us produce more content like this. Alternative media like Gript needs all the assistance it could get, and every donation goes a long way. As always, thanks for watching.